Assalamu alaikum, everybody. Thank you for your time and your interest in this very important subject of the day. My name is Rashid Ahmed. I am Executive Director of Imana, and this session is designed exactly to become a resource for these kind of needs. Like, somebody can perhaps go from one of the Imana members, one of the clinics. We can coordinate these kind of needs. We can work together, develop a platform. That way we become the resource for it, because we can't do it. We are not running such a clinic on our own, but we can certainly bring together people and provide this kind of knowledge base. I also thank our panelists here, Dr. Yasser Aman, Dr. Altaf Qasruddin, and Dr. Taif Kaisi. Today, this session is designed for people who are interested in offering health care at low cost or no cost to underserved population. There are many different ways to serve the underserved population, entirely free or federally funded, or a network model, which three of these doctors are actually practicing a different model. They will go over each of their model and they will explain, and you will have an opportunity to understand, and if you have any follow-up questions, we will also cover that. Dr. Yasser Aman here has to leave for a flight. Dr. Yasser is currently serves as the President and CEO of University Muslim Medical Association, community clinic, Ummah. This is the first clinic which is started by Muslims, Muslim physicians at that time, perhaps Muslim students at the end of their medical school in Los Angeles area. Dr. Yasser Amman will cover the model that is federally funded, federally qualified. That means it qualifies some funding from the federal, which again he will go over. So I invite Dr. Yasser Aman to come and go over.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على سيدنا وحبيبنا محمد صلى الله عليه وسلم السلام عليكم ورحمة الله. I wanted to just thank on behalf of the Ummah Clinic for Imana inviting us to this opportunity to, I guess, immortalize this presentation through actually doing presentation for people here, as well as recording it for a future, inshallah. So we ask Allah to benefit, us to benefit, as well as anyone who sees this, inshallah. I was tasked to kind of talk about the Ummah from the federally qualified perspective, but alhamdulillah, Ummah actually experienced both being a free clinic, a community clinic, as well as a federally qualified health center. But this is not going to be just an Ummah presentation, because I want to get really into the technical pieces around becoming a federally qualified health center, but I wanted to at least tell our FQHC story through our history. And so I would just, today I'm just going to go through the FQHC story, as well as what is the difference between the FQHC as well as the FQHC lookalike, as well, and then also the potential impact that health reform has with the FQHC program, inshallah. So Ummah, our mission, from the beginning, University Muslim Medical Association was started by a group of Muslim medical students that actually wanted to just respond immediately to the 1992 riots that happened, that caught the attention of the world, as well as specifically in South Los Angeles. And so there was a group of energized Muslim students that didn't want to just contribute to the cog of the medical machine, if you will, but they actually wanted to actually do something, and so they started up with a idea of being a mobile clinic, of having a mobile clinic. But interestingly enough, which is a theme that will resonate throughout my presentation, which is the core and essence of what federally qualified or community clinics are all about. The community said, we're sick and tired of mobile things. And because of that, because they were sick and tired of money coming in, And when money comes in to rebuild LA and so forth, and as soon as that money recedes, so does the help. And so, mashallah, the founders at the time actually took it upon themselves to take a mobile idea and actually build an institution. So with the help of the UCLA School of Medicine, Charles University, and the city of Los Angeles, they actually identified this building called the Child Care Center Betty Boop. That's where we were in 1991, which was a condemned child care center, which was filled with asbestos, exposed wiring, roaches, and so forth. And so a lot of the local politicians actually caught a lot of heat for shutting down this particular service to the community, because a lot of single moms now didn't have a lot of place to go to drop off their kids. And so as soon as these wide-eyed Muslim students wanted to actually do something, they knew exactly, and they pointed to this building. And alhamdulillah, over the years, now this is the building that we have now that we recently renovated, thanks to, alhamdulillah, the recent ARA funds that came during the stimulus package. But and I'll be very brief with the history because I want to jump into more of the FQHC piece. But from 1996, when we actually opened our doors, to year 2000 was when we were called the Ummah Free Clinic. We were literally going to shut down in 2000 because the medical students at the time did not go through any business planning school or strategic planning and so forth. They fundamentally moved on to residency program, and they didn't necessarily have a plan after their initial grant. And so, alhamdulillah, in year 2000, we raised $384,000 in one night. And that was the first time we went to the Muslim community. But we realized that one night that a institution like Ummah cannot be sustained, especially providing a very, very expensive product like healthcare, to a consumer base that doesn't have money to pay for it. And so fundamentally, it was a shift in our mindset that if Muslims want to establish an institution, they have to do it from sustainability's perspective. And so they had to think of diversifying the revenue. And so that's when we started writing grants. And it was difficult to write grants because it's like trying to get your first job. You have to get your first grant to get your first grant, to have grants to get your first grant. So it was a challenge, alhamdulillah. And then we started to have the philosophical debate that I'm sure free clinics around the country have, is should we bill, should we not bill, what does it mean to bill, the level of infrastructure and complexity of the organization that it soon becomes once you start billing. But we decided through a lot of introspective conversations that Ummah could not be considered as a pet. A pet is something you kind of dress up, sweaters, and make you and I feel better and good about ourselves. But actually, we had to look at it as a child with an amana, and actually ability to see this small organization become something bigger. So we then started the path of FQHC, or the Federally Qualified Health Center. And so this is just more of a snapshot of what we do now. Over 35,000 patients since we started. We do around 16,000 patient visits a year. Often a lot of people see it, maybe think that we serve mostly Muslims. Obviously we do not. In South Central Los Angeles, we effectively serve the community that reflects the community that's around us. So predominantly Latino, African American, and people who are monolingual, people well below the federal poverty level. So our next project, just to briefly, just like we thought it was unacceptable when the Los Angeles was in flames, that a city can burn its institution and businesses down, and Ummah was born out of that. When we found out that one of the largest high schools and the second largest school district in the United States had significant health disparities, we decided to join with the Los Angeles Unified School District to build a school-based health center, which is essentially going to be a community clinic, 5 exam rooms, 3 peer counseling rooms for behavioral health, and also this clinic will be fitted for dental. But what the interesting thing is, and there will be 2 entrances, one for the students and one for the actual community. And we're very excited about this because 1, the school district is paying for the building. 2, alhamdulillah, we're charged to actually obviously come up with the operational dollars, but to fundamentally serve a very, very vulnerable population, which almost every time I ask the principal, 46, 47 girls are pregnant, is 5,000 students to go to this particular school at Fremont High School. But nothing in the country has been done at this scale where we will be adjacent to an acre garden. Alhamdulillah, there's actually an acre open space anywhere in South Los Angeles is unheard of, but the fact that we're actually on campus, the clinic is where that big arrow is, and this particular garden will actually have orchards, places where you can actually rent community plots so people can grow their own fruits and vegetables. There will be a kind of a meandering park where we'll potentially, inshallah, do yoga classes, and a whole place where we potentially can do a farmer's market. And we will ultimately integrate what happens at this particular garden and clinic in the curriculum for the students, so we actually can kind of really get deep into exposure to health, medical, career choices, as well as agricultural choices. So alhamdulillah, this is set to open in January 2013, inshallah. So for FQHC purposes, why don't we just get started on the technical part. How many here are actually either involved with a current community clinic or a free clinic, or so is that more on the volunteer side? Yeah, and so a lot of times when I start doing presentations like FQHC, the intent is not to intimidate. It's not to kind of create such a high barrier of what I'm about to describe. It's more of just kind of an option. There will be other options that Muslim communities can do, but is an option for communities that want to actually build a community clinic. And there is like a formal program called the Federally Qualified Health Center. And it's not new. 45 years, the community clinic movement has been way in the forefront around all the buzzwords that you hear around health reform now, in terms of coordination of care, being a medical home, and so forth. Community health centers have been doing that for a very long time. The Federally Qualified Health Program is actually it's under the Section 330 Public Health Service Act, which is a specific part of allocated monies that can either fund 3 or 4 different programs. 1, community health centers. 2, actually migrant health centers, right? So clinics that actually follow the path of migrant health workers. There's also public housing grants. So actually community clinics can apply for federal grants and do it within major public housing programs. And then homeless grants as well, and also school-based health centers. So those are the kind of the main categories. And then there's something where you're not necessarily an FQHC, but you look like one. And I'll get into the distinction between that, because Ummah tried and failed close to 6 times in trying to get the FQHC. And we said, forget it, let's try to do the lookalike. Alhamdulillah, we got it, and then we became an FQHC. So I'll kind of describe that. They have to be private, charitable, tax-exempt organizations. They can join with public entities. In other words, FQHCs actually can join with local county departments or local public dish hospitals or publicly funded hospitals, and actually go in together as a co-applicant, so that is possible. But they are also they are mandatory to provide care for everyone, regardless of ability to pay. And so that will be a critical piece that I'll get into later on. Essential components is that it is community-based focus, and I'll get into the governance piece later on, but 51% of your board of directors actually have to be patients, consumers of your services. And they have to be specifically located in what the federal government or HRSA calls medically underserved areas, MUAs, or medically underserved provider shortage areas, or MUPs, right? So these are specific areas that if you are considering a lot of times I get calls from different communities that actually want to start community clinics, but it just so happened, they say like, well, we want to open up a clinic next to the mosque, but the mosque itself is in a very affluent area.